G Thing. Brought to you by the more than 72,000 people who believe wellness is a journey we take together. Northwell Health.
Their hospitals were flooded with patients. Northwell Health, New York's largest healthcare system, has cared for, you ready? Nearly 70,000 COVID-19 patients, more than any other health organization in the nation. And now the president and CEO, Michael Dowling, has documented the time on the front lines in his new book, Leading Through a Pandemic, the inside story of lessons learned about innovation, leadership, and humanity during the COVID-19 crisis. Can you just tell us a little bit about what went into your thought process in writing this book?
None of us in any line of work, especially in healthcare, have worked through a pandemic before. So I thought it would be very, very helpful as we were going through it to basically document what happened and to basically reflect on our experiences.
And that documentation is telling. Governor Cuomo calls the book a clarifying must-read in uncertain times. When was the first sign for you and the hospital system that this one was a huge wall of problems heading in your direction?
Well, we began to think that this could be a huge issue when we were observing what was going on in Wuhan and in Italy. If you think of the thousands of people that show up at Kennedy Airport and at LaGuardia Airport every day from all over the world, it was inevitable that we were going to have a situation here. So we began our planning way back in January in anticipation of something that could be pretty severe.
You make a very interesting point in the book, which is a great read, that sometimes it's good to overthink a situation, anticipating a problem. Can you explain that, please?
You asked the question, what if? And we're always doing that here at Northwell. What if this terrible thing occurs? Do we have the staff? Do we have the supplies? Do we have the beds? Do we have the people? Do we have the leadership?
Can you tell me what your day was like during the height of the pandemic?
I walked the floors of every ICU, and I did it pretty much every day. I could see the unbelievable compassion in the staff. I could see the commitment that they had, but I could see the nervousness and the fear. What made Michael stay the course, stay positive? And if you had a down moment, how did you handle that yourself? It's not what happens to you that matters in life. It's how you react to it. I'm an optimist by nature, and you have to, people are looking for leadership to say, yes, we will win. There is no retreat here. We are a good organization. We have great people, and we're not going to succumb to defeat. And the fight is far from over. Northwell Health is now preparing for the potential of a COVID resurgence. We are developing plans now and have them developed. So if this comes back this year, next year, a year from now, 5 years from now, we will even be better prepared. What kind of staff do we need? How many beds do we need? How much PPE do we need? So we do all of these exercises all the time, and we prepare to the maximum. Michael says it's important for everyone to understand the fight is far from over. It's not time to become complacent. This is something also that the public has to be a partner with us on. They cannot relax. They got to use masks. They got to social distance, because this is not over.